Want to grow your business and take it to the next level? Well, here we all are, and we're going to show you how through hard work, perseverance, and a little help and know-how, you can take things to the next level and push the success of your business even further. Let's get going.
Welcome everyone, Paul Wright here to the next episode of the Practiceology Podcast, the science of teaching allied health businesses how to run practices that work without them. And today I've got Jeff Langmaid with me. Jeff, thanks for joining us.
My pleasure. Thank you for having me.
Now, and poor old Jeff, I reached out to Jeff from nowhere. He doesn't know this Australian guy from a bar of soap, and he's just put he's just put his wine glass down. He's having a great afternoon, so we'll see what he comes up with. But this will be fun. Now, Jeff's an experienced chiropractor, speaker, founder, author, and creator. He's practiced as part of the leadership within one of the largest orthopedic groups in the world, and has participated in the side of healthcare that new chiropractors and health business owners get to experience. He's the founder of the Evidence Based Chiropractor, the Smart Chiropractor, Chiro Office Coverage, and OA-MSI Diagnostics. So he's in lots of different spaces, and he's dedicated to helping chiropractors and allied health professionals achieve more in practice. He's been featured on Yahoo Health, CBS News, MSN Health, so he's been around the place, and he's calling in from beautiful Tampa Bay, Florida. Great introduction. I can't wait to hear what you're going to rip in, Jeff. You right to go?
I'm ready. Let's do it.
All right, let's start the timer. Your time starts now. Jeff, who is your ideal client?
My ideal client are healthcare professionals that are looking to grow their practice with relationships instead of transactions, by building trust and rapport. And we like to think of it as teaching and inviting. We love working with docs that love getting out there and teaching, then inviting their ideal clients to take the next step and become a member of their practice.
So question 2, you're on fire with 6.5 minutes left. So what's the problem you solve for these health professionals?
Yeah, almost every practice out there has holes. We call it holes in their bucket. Our job is to fix the holes in their bucket so that healthcare professionals have proven systems that can automate their patient attraction and retention. And we're going to get into some of the challenges and stress points that we see with it. But man, this is a major problem in so many practices out there.
Well, question 3 then. So what are the typical symptoms people experience with holes in their marketing bucket or their business bucket?
Yeah, I mean, the obvious ones are more stress and less revenue, but really what you'll notice is the roller coaster or yo-yo practice. You're busy, you stop doing things, you get less busy, you start doing things, and you notice you just always feel like you're on that treadmill, you're on that roller coaster, you're riding the yo-yo up and down month after month, quarter after quarter. That's a good indication that you have broken systems and processes when you're always reactive instead of being proactive.
Okay, so question 3 then, with 5.5 minutes left. So what are the typical symptoms, people experience with their holes and their buckets and their business systems? What are the big symptoms they have?
Yeah, it's all about, stress, less revenue, and that up and down yo-yo. That really taxes, I think, everybody individually, and it taxes the practice. And when you can have systems and processes that enable you to focus on your ideal patients and clients, makes practice a lot more fun, makes it more profitable, decreases your stress, and it gets you off the roller coaster.
So question 4 then, with about just under 5 minutes left. So common mistakes people make, I'm sure there's a stack of them. What are the big mistakes they make with their systems, processes, and fixing these holes?
Yeah, there's a couple external and a couple internal. Some of the biggest things that we see externally are running deep discount ads to try to make up for holes in the bucket, right? Come on in, and for $9.99, we're going to give you everything in the kitchen sink. And it malpositions your practice, but it might be that you feel as though you need new patients before the end of that month, and you make that sort of rash decision. Also, kind of falling for gimmicks, right? Not having systems and processes, but really doing things, as we talked about at the beginning, transactionally instead of relationally. I think of transaction as short-term, relation as long-term. And finally, internally, delegating, what you think should happen to your staff and team members who aren't experts. Oh, well, we have, Martha at the front desk is young and has an extra hour. She should handle our email marketing. You really want to have experts handle things. And if you're delegating things to people that aren't up to the task, you're running discounts or you're doing gimmicks, chances are you have challenges with systems and processes.
All right. Well, question 5 then, with 3.5 minutes left. So what's a valuable free action, Jeff, that our audience can do to help fix this? What can they do to help their problem?
Yeah, it's a great question. So it's hard for me to narrow down, but I will. We automate everything through social, through email, through streaming video. We create all the content, all the automations for our doctors so they can get their message out there. One of the big channels we've seen this past year is Google My Business. So make sure that you have your NAP correct. NAP means name, address, physical and line, and phone number. So if you get your NAP correct, there are 3 actions somebody can take on a Google My Business listing. One of them is to give you a phone call. So you want to have your phone number correct. Number 2 is to request directions. You want to have your address correct. And number 3 is click to your website. So you want to have your website correct. So go in, verify those listings, pop up a few great pictures of inside your practice to reduce friction and fear for somebody that hasn't been in yet. And then make sure you are posting to that listing because, man, we have seen 20,000 quote unquote leads, as Google My Business calls them, to all of our members each and every month. And they spike every time we post to the listing, but those posts expire after 7 days. So make sure that you're staying consistent with that. Think about it through our Teach and Invite framework. There's
very few times where something free comes along that works and is really good, but you Google My Business. As you said, if you're not involved in that, you're in all sorts at the moment. So
it's a must. It's not a nice to have. It is a must have.
Question 6 then, with about 2.5 minutes left. So what's a valuable free resource, Jeff? What can you give our audience to help them grow their business and get their head around this whole marketing idea? What have you got for them?
Yeah, so there's one direct free resource, and the name of the company is The Smart Chiropractor, but it applies to all allied health professionals. So, any service provider out there, this is going to apply to. You can head to thesmartchiropractor.com/social media marketing with the dash between social and media. Or if you just want to visit the blog, if you visit blog.thesmartchiropractor.com, you're going to see over 100 articles, clinical, marketing, how-tos, you name it. It's all there for you. I'd encourage you to go check it out. There, you will learn something that can improve your practice today if you go in and do a little bit of searching.
What was the URL again, Jeff? Where do they go?
The URL would be thesmartchiropractor.com, and you can click on the blog at the top. Or if you want that direct social media guide, you could go thesmartchiropractor.com/social media marketing with dashes. We'll drop that in the show notes. I know you're a pro, Paul.
It'll be underneath the show notes, but it's a great resource to have a look at. And question 7, Jeff, with about a minute left. What's the one question I should have asked you that would give great value to our audience today?
I'm going to have to go with what we are eminently launching because I'm excited about it, but I also think it's super powerful. And that's how can I create recurring revenue in my practice? So many docs out there, we saw struggles when you had to close your 4 doors and you weren't able to deliver hands-on care. So many providers struggled because they don't have any back end or revenue channels that's recurring and automated. We're launching an e-commerce platform that we're super excited about. And guess what? We're powering it. Of course, the marketing and sales components with all of our automations through the email, through social, through video that we already take care of for our docs and members. So we're super jazzed about that. And I'd encourage, check out, there are Ritual, Hims, Hers, Athletic Greens, all these companies that are, becoming unicorn companies, as we call them over here, billion-dollar companies. And they are doing a lot of things that allied health professionals can and should be. And what you're probably already asked about by your patients, but you just don't have a solution for.
And what sort of products are we promoting here, Jeff? What's our recurring income? Mind for us? That's an extra
that's a great question. So we think about recurring revenue in 3 different buckets and categories. One is ensuring that you have a continuity program in your practice that's compliant, obviously. Ensure that you have something where you can deliver hands-on care. Number 2, which I'm most excited about, is drop-shipped supplements. And we talk about these everyday, everybody type supplements, not therapeutic, but greens, D, multi, these things everybody should be taking that they're buying crap off Amazon and competitors. You should be supplying them with drop-shipped. You shouldn't have what I call the graveyard of seminars past either, trying to sell them in your practice. You need to have it online. You need to have it automated. And the third piece about it, which we're also excited about and in the process of developing, is an app. Being able to have an app, an online movement and exercise app, is a great thing to do. You're not trying to compete with Peloton, but you want to have the basics done so people can go through guided movements guided by you each and every day. So we're trying to put that together as well.
Thinking outside the 4 walls of your practice. I love that we're so caught up in trading time for dollars as therapists, aren't we? It's a great way to think about your practice.
Absolutely. I could not agree more.
Jeff Langmaid, thanks for joining us on the Practiceology Podcast. You're a superstar. That was great.
Oh, my pleasure. Thank you for having me.
Now, if you haven't checked out our monthly Practiceology demonstration, head over to mypracticeology.com and I'll see you on the next episode.